Hey everyone, this is Dr. Nate from Back to Health, and I'm here to share some new exciting information with you. We're going to be talking about clinical care guidelines today. What guidelines are? Basically, guidelines are directives that are issued that are based off of research, and all doctors will kind of go to these guidelines and will read them, and basically what they're supposed to do is give us information about what the most efficient and the most effective ways to treat a patient is for any given condition. Today I'm going to read something out of the Annals of Internal Medicine. It was just released in February 2017, so it's a relatively new guidelines here. It's called the Non-Invasive Treatments for Acute and Subacute and Chronic Low Back Pain, a clinical practice guideline from the American College of Physicians. These guidelines are really important because the last time that these guidelines were updated was in 2007, and there's been some big changes over the last decade. Here's some of the big changes. One of the biggest ones is that opioids are essentially being shunned and are only being recommended as a last resort approach for the care of acute, subacute, and chronic low back pain. A little quote here from the research: physicians should consider opioids as a last option for treatment and only in patients who have failed other therapies as they are associated with substantial harms, including the risk of addiction and or accidental overdose. So I'm sure it's something we can all agree upon. We've read a lot about that. We've heard a lot about that. It's good to hear the ACP coming out and taking a stance against opioid use, putting them only as a last line of approach. However, another big change is that they've created non-pharmacological interventions like chiropractic care as a first line approach. And that's very important because they're actually putting these ahead of non-steroidal anti-inflammatory drugs, or what you guys may know as over-the-counters, Tylenol, Advil, ibuprofen. They're actually coming out and saying that chiropractic care should be used ahead of those medications. So the evidence showed that acetaminophen was not effective at improving pain outcomes versus placebo. So in the research, they gave patients a sugar tablet and they gave them an over-the-counter anti-inflammatory like Tylenol, and they found that there was no difference between them. For patients that had inadequate response to non-pharmacological therapy, clinicians and patients should consider pharmacological treatment with non-steroidal drugs next, and then followed up with tramadol or duloxetine as a second-line therapy. So again, they're reiterating you should try non-pharmacological interventions. Specifically in the paper, they mention spinal manipulative therapy, which is one of the hallmarks of treatment that we use here at Back to Health. So if you yourself are suffering with neck or back pain, or you know somebody else that is, give us a call here at Back to Health. Follow the guidelines. Give this type of treatment a shot first, and if it all fails, we could always go to the next options and follow the care down the line from there.